Today I will be doing a central line dressing change. We know we need to change our dressing if it has been 7 days or if the dressing is wet, soiled, or loose. First, I will start off with washing my hands, and I will clean the surface, putting on gloves. I will clean the surface around me with antibacterial wipes, making sure it's dry, then discarding of these gloves, and then yet again, hand hygiene. Next, I will mask up myself and everyone else in the room. And then I will put on gloves, and we will be removing the old dressing. So I don't have an actual central line in now, but we'll talk through it. So first I will start with the anchor. That's the bottom part, and it holds the line in place. I would tear from the middle and out and discard of that. And then I would stabilize the top, making sure the line does not pull. And I will start from the bottom, taking that dressing off and discarding that with my gloves. Then I will perform hand hygiene yet again. Next, I will, while the central line is open, I will look into it and make sure there's no signs of infection. And I will get out my kit using sterile technique, making sure that I am not crossing any of the sterile borders, and open up. These are my sterile gloves. And making sure nothing touches the middle. And for time reasons, and these gloves don't really fit my hands, I'm going to pretend that I put both of them on using sterile technique. Now that my sterile gloves are on, I'm going to take the chlorhexidine sponge that's not in here, and I will activate it by clipping the sides and allowing all of the stuff of the chlorhexidine to get to the end. And I will then start to clean the area, going back and forth for 30 seconds. I will allow that to dry by itself. Then next, I will take the chlorhexidine sponge and then put it, say the line would be here, the chlorhexidine patch. I will put it here, opening it and putting it right on the end of the insertion line, either being at the 5 o'clock or 7 o'clock position. Then I will take the skin applicator and I will put that all around the borders for my dressing to be able to stick. Then I will apply the dressing, starting with the top. I would take the top portion off. I would remove the backing of the top portion, and I would stick it on, getting all the creases down and making sure it's stuck. And then I will stabilize and remove the back portion and putting that on. And I will bring the line through to make sure that it is not stuck in with this applicator. And then I will grab, I don't think we have an anchor. Then I will use the anchor to then put it up on the sides, and this will stabilize the line so that this will not move and the line will not be pulled. And at the end, I will write the date as to when I put it on so I know when my next dressing changes. Today I will be drawing blood from a peripheral site. First, I will hand hygiene. I will get to patient identifiers from the patient and match it to the order, making sure I have the right patient. And I will ask if they fasted, if needed for this blood draw. Then next I will glove up, and after I perform hand hygiene, and I will make sure to collect all my supplies, being the color-coded tube tops, making sure I have the appropriate ones of them, my needles, alcohol prep pad, and some gauze. So then next I will look at my patient's arm, and I will apply the tourniquet. I will look in the antecubital fossa to look for the median cubital vein, and I will palpate it, making sure I am touching the artery and not the vein. Then I will take an alcohol prep pad and I will clean the area, and in a circular motion, allowing it to dry by itself, giving my patient a warning when I'm going to puncture. I will make sure the evacuated tube is on the back of the needle. And when I puncture, I will grab my thumb, pulling the skin back and going in at a 30-degree angle and doing a firm and quick insert. And then once I see the blood, I will then remove the tourniquet and I will have the patient open their hand and I will make sure to collect all the tubes as possible. After that, I've gotten all the blood that I needed. I will remove the needle, putting the safety on it, discarding the strips container. I will apply firm pressure to the site and apply a bandage, making sure that there's pressure for several minutes on there. And then I will make sure to clean up all my area. And then I will label each individual tube, making sure it has all the correct information for my patient, myself, when it was collected. And I will store it for transport. And after that, my area will be cleaned up and I will send my tubes. Okay, so today I will be starting an IV. First, what I'll be doing is gathering all my supplies, my IV starter kit, 22 gauge, my extender, my extension, and my saline and my gloves. I will go into the patient's room and inform them what we are doing with the IV, letting them know what it's for, signs of if there's infiltrate, and that sorts. Then next I will put on the tourniquet and I will try to find a vein in the either AC area or in the hand. Next I will do hand hygiene, put on my gloves. And then I will prime my extender. I will use a saline and I will attach it. And I will make sure to get the bubble out by pulling back. There we go. And attach that there, flushing it, making sure the water's going through, leaving the other cap on so I don't have any risk of infection, keeping that to the side. So my tourniquet was here, my starter kit, and that was on my patient. I will then get 2 pieces of tape about 4 to 5 inches and splitting it in half and putting that to the side. Oops. And then I will clean the area with my chlorhexidine. So I will snap the sides, letting the stuff come to the bottom, and I'll just say this is the hand, and I will clean it. After I found my vein, I will clean in a circular motion and letting that dry by itself. And then I will take my 22 gauge needle and taking off the top and make sure to move it around so I'm able to advance my cannula a lot easier. Then I will find the spot that I need. I will go in, insert the needle, and then when I see that there's blood in the chamber, I will insert just a little more, and then I will advance my cannula. This needle, I will put on the safety and discard into the needles basket. And then I will put my finger down so that there's no blood that comes out. Taking my extender, I will remove this cap and attach it, making sure it's tight. I will flush the saline through, and then once that is all flushed through, the patient doesn't complain of any pain, and there's no bulging into the area around the IV site. I'll move this. And then I will take my tape to stabilize it. One will go over, and then I will put one under. Oops. And kind of crisscross it there. It's not the best tape job. And then I will then put my Tegaderm on onto it so that it is stabilized. And I will write the time and date onto the Tegaderm, and I will document and chart my IV, and is ready to go.